Okay. Water in your dam? Water, it's full.
Certainly gets opening. Doors.
Oh, thank you.
You're
I'll
welcome.
make sure she gets it.
Okay.
Oh, no worries, yeah. Okay, thanks, Tina, I appreciate it. Okay, bye. Sorry. We're good? Just trying to get the last person for the quorum. I think we've got it, I think.
I'd like to call this, this is Mayor Ken Tedford, I'd like to call this meeting of the Central Nevada Health District Board to order. If you'd all rise and
This
help
conference
me
will now
pledge
be
allegiance
recorded.
to the flag. Would the clerk please take roll?
Chair Ken Tedford,
Here.
Justin Heath, Bob Erickson,
Here.
Denise Ferguson,
Here.
Larry Rackley,
Here.
Jeb Rowley, Rich McKay, Pete Olson, Don Witten, Tina Manzini. Tina, are you there? It says she's, I don't remember. I think it was like muted on that. This, but- I don't know.
So Tina she's appearing as, participating, but either we can't hear her or she can't hear us.
I could probably just keep you on this phone, Tina, if you want to. You just want, I'll just keep you on this phone, Tina. Unless- Okay, hang on a second. Hi, can you hear us? I can hear you.
Tina, I'm going to call your name again for roll.
Okay,
Tina Manzini.
I'm here.
Thank you.
Is that mic on by her phone? Okay, thank you. All right, then, do we have a quorum?
Yes.
All right, we'll go to item 4, public comments must be general in nature, not relative to any item on the agenda today. Discussion can be held, but no decision can be made. Is there any public comment? Mr. Clifford?
There we go. For the record, Bob Clifford, Fallon, again. Mr. Chairman and board members, good afternoon. I've provided another package, 5 pages of links to articles. Now we're seeing peer-reviewed study after peer-reviewed study showing that the shots, the COVID vaccine shots, and the other public response things like shutdowns caused almost all of the COVID-related deaths, not COVID. And then there's different stats depending on how you look at it. But we're still running 50% excess deaths. It's killing the life insurance companies. People are dying at 50% above the regular death rate in the United States. And the studies are now what they're doing. They're doing really in-depth analysis and in-depth medical, diagnostic of tissue diagnostics and things like that that are showing not just correlation, but a cause effect. Actually, they actually understand the mechanism and the cause, what the shots are causing deaths. Japan is now officially calling it the biggest crime in history. That's a pretty strong statement. And of course, the U.S. government is oblivious. They're in on it. The state of Kansas, as an example, sued Pfizer for misleading the public about the safety and efficacy, and there's a lot more government suing, local governments suing over these issues. Some of the studies are now coming out where there was a big surge in Alzheimer's, and they've now related that to the COVID vaccines, and also a big surge in neurological related deaths related to the COVID vaccines. So the former CDC chief, the guy that was the head of the CDC during the pandemic, states that mandates were one of the biggest mistakes, presumably, that they've ever made. And a lot of other leaders have come out and said that they lied at the time about the safety and efficacy. Just they didn't want to cause vaccine hesitancy, so they lied. They lied to us. And I love this. Harris, that would be Kamala Harris, vows to accelerate WEF, World Economic Forum, plan to depopulate America. Gee, I wonder how they're planning to depopulate America. Ever wonder why we were all forced or encouraged, at least, to get the vaccine, but there were no vaccine requirements for illegal immigrants crossing the border? Did that make sense? Is that consistent? What's wrong with that? Maybe that's what they call the great replacement at work. Kill off all of the citizens and bring in new people to replace them, and don't give them the vaccine. Since the population's caught on, they're gearing up for a new bird flu pandemic, and the FDA says they're going to issue an emergency use authorization for a bird flu vaccine. I mean, they're planning it. They've been working really hard to make it transmissible in humans in labs all over the world. I mean, this is a setup. They have to have their new kill shot. And what they're doing now is Bill Gates and the World Health Organization and others are saying, we're going to have the military and the police force vaccinate the population. Well, that's because the population's not going to volunteer anymore. People have caught on to this. Anyway, my advice, if your doctor still supports these shots, get a new doctor. Thank you very much.
Okay, we'll incorporate your handout into the record. And any other public comments? Being none, thank you. We'll move to verification and posting of the agenda in compliance with NRS.
Amber Edwards, for the record, verifies that the agenda for this meeting was posted on the first day of August 2024 between the hours of 3 p.m. and 5 p.m. at all the locations listed on the agenda.
Moving to, thank you. We'll go to item 6A, approval of the meeting minutes of July 11th, 2024. I entertain a motion.
Mr. Chairman, I'd move that we approve the minutes of the meeting held on July 11th, 2024.
This
You have
is
a
Jed
second?
Rowley in Eureka, and I just want to reflect for the minutes of the last meeting. I was in attendance. I was not on the roll call, though. If you could make the motion to include my presence for the last meeting, I would second that motion.
Okay, we'll make that correction. Will you amend your motion, Bob?
Chairman, I agree to amend the motion.
We have an amendment to that motion to that effect. Do we have a second?
This is Denise. I will second.
We have a motion, an amended motion, and a second to that amended motion. All in favor?
Aye.
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 None opposed? Motion carries. We'll move to item 7A, new business, the resignation letter that we received from Tyson McBride, who represented Pershing County. Any comment? If there is no public comment or comment from the board or from Darren? Do you have comment, Darren?
Mr. Chairman, members of the board, just for the record, I would just like to go on record saying thank you to Tyson for his service. Certainly hard to come on a board like that and for his first year and not understanding everything that's going on. And Tyson was great to work with and certainly a partner, will continue to be a partner as we move forward. And yeah, I just wanted to say thanks to Tyson.
He was an asset to the board. His work makes it where he felt he couldn't attend meetings like he should, so that's the reason for his resignation. At yesterday's commission meeting in Pershing County, we did appoint a new member to the board.
Okay, thank you. I echo Darren's comments about Tyson, much appreciated, and you can relay those if you would, Larry, to Tyson. I'd entertain a motion to accept his resignation.
I really don't want to, but this is Larry Rackley for the record.
Sorry, if I may interject, this is not listed for action today. It's
Okay.
not notified that way. I don't think there needs to be any. There's the letter.
Doesn't have to be any,
He's no longer a member of the board just based on the letter, so.
Okay, good enough. Thank you. For information only, we'll go to item 8A, the fiscal report for 24 to current.
Mr. Chairman,
Darren.
members of the board, for the record, Darren Winkleman, just wanted to give you a brief update on FY '24. It was an interesting year all the way around in terms of the grants and how the grants came in from the state, but we're pleased to announce that we have successfully implemented all of those grants and obtained the majority, I think, of the money that we had the ability to in those grants. We, as you know, had an interfund loan with Churchill County. We were able to pay back that loan. That's all squared away. We're going to be in the black, as they say, within our budget. And so we're pleased moving forward into FY '25 that we have a little, I guess, for lack of a better way, cash in the bank, which is exciting for us for the first time. I'd be remiss if I didn't, and I'm not sure if she's on the line, with Shasta Garrison, who is one of our office specialists in Hawthorne, Mineral County, came to the rescue for us. one of our grant and fiscal person has been out due to an accident for several weeks now, and Shasta came in and really was able to work with the state very, very well. I've got numerous comments from the state about how easy she is to work with. She was able to gather all the data, do our, what we call request for reimbursements to the state, and caught us up. And continues to do that work today to finish out the rest of FY24 as we close out some of the smaller things, but also working in FY25 to get us kind of back on track a little bit better. So hats off to Shasta for coming, like I said, coming to the rescue. But other than that, you have a little bit of a financial revenue versus expenditure report. I'm happy to answer any questions if I can. Shasta is probably better at it than I am, but if she's not on, I'll do my best if there's a question or two. Okay. Thank you.
Any questions from the public or the board on FY24? Being not, then you don't want acceptance of this. You don't want acceptance of this. It's just informational, correct? Okay, we'll go to 9A. Staff updates or staff presentations. Darren?
Mr. Chairman, members of the board, for the record, Darren Winkleman. I'm going to do a quick update on myself, and then I'm going to turn it over to staff who really do all the work for us and certainly make me look good sitting up here. I just wanted to give a quick update on, we did have a kind of a rabies, I guess, question that came up a couple weeks ago through the Department of Ag. And so we had a great meeting, I think at least it was a great meeting with the Ag Director, along with his staff, and Dr. McDonald and Victoria, our epidemiologist, went to meet with him, and just trying to understand a little bit about our response to rabies and who kind of the Rabies Control Authority. And I think we've kind of scored that away. I think I need to work with Jeff a little bit on some of the other counties and kind of how that Rabies Control Authority works. But other than that, I think that there was a little bit of miscommunication, and I think we were able to work that out. And certainly the State Ag Department is a partner for us in this endeavor, and we want to make sure we're meeting their needs and as a stakeholder. And so I think we ironed that out, a pretty good meeting, and I just wanted to give a quick update on that process. And the fun topic always this time of year is Burning Man. Just want to let the board know we will be out at Burning Man beginning on the 22nd, and most of the staff will be out there. We'll be kind of short here in Fallon, just so you know. We'll do the best we can to respond. I think we have a mechanism to do that with some satellite stuff, but maybe a little bit delay in some of those responses, but we'll do the best we can to make sure we're checking in as much as we can. So with that, Mr. Chairman, I'll turn it over. I wanted to make sure the board had an understanding of where we were over the last year, and I thought the best way to do that is to allow staff to present into their different realms and what they've been up to, and just kind of they've been busy, and I think you'll see that. And so we just want to let them have an opportunity to be in front of you to see, kind of refresh their faces, and again, let's let them let you know what they've been up to. And I think we'll do Desi Reeves, who is our clinical manager, will allow Desi to go first, if she will. And I want to just right there, be great. Thanks, Desi. And just
Good afternoon, Mr. Chairman, members of the board. I'm Desi Reeves. I'm the Clinical Services Manager for the Health District. And you have a packet with the year in review for clinical services, so I'm just going to summarize some of the information. We opened the clinic last year in July, and we were primarily focused on childhood immunizations and outreach events. And at that time, we did a lot of back-to-school vaccines. July to September, pretty much nonstop vaccines. And then October, we start flu. We also had a lot of senior center visits, and then we were getting our lab ready for our CLIA Wave lab license and learning our electronic record system. In October, we added family planning services for our clinic, which is birth control, PAPS, STD testing and treatment. And then in November, we took over the TB testing for New Frontier Treatment Center. So in our first year, we did 28 outreach events. We had 11 back-to-school vaccination events and 11 community flu shot events. We also attended 7 community resource events where we handed out information about services and just let people know that we were here and what we do. We also sent our contract nurse to the senior centers in all 4 counties 61 times in our fiscal year 23-24. We did blood pressure checks, education, flu, COVID, and other adult immunizations at those senior centers. As of June 30th this year, we administered 1,372 immunizations between the 4 counties. And our resource liaisons, who are all licensed community health workers, assisted our provider with client referrals to specialty providers, attended advanced certification trainings, and shadowed CHWs from Northern Nevada Public Health. In our family planning services, we had 225 patients scheduled among the 4 counties, with the highest number of patients being in Churchill and Mineral counties. Our APRN Kathy also passed her Board of Pharmacy dispensing exam in February of 2024, and she was able then to start dispensing medications from the clinic, and we have prescribed or dispensed to 15% of the patients we've seen so far this year. We have a no-show rate in the clinics of about 37%. So we do phone call reminders, but that seems to be the trend in public health. About 30% of your patients don't show up, so there's a lot of rescheduling that happens. And about 93% of the patients we see qualify for sliding scale fee adjustments, so that's quite a large number. We just recently got our Medicaid provider, so we're really excited about that, and we're working on getting credentialed with other insurances as well. Since we started TB testing, we have done 152 TB quantiferin blood tests. We've had 7 follow-up chest x-rays related to those results, 2 patients who were treated for latent tuberculosis infection, and 36 TB skin tests, which we added on later, primarily because of the high school students who needed to be TB tested for shadowing in the hospital, and then it just kind of took off to the public, so that's been good. We also notify and test the new arriver immigrants who come into the United States on a Class B waiver. So those patients are come to us, and we test and treat them if they need treatment. And additionally, as part of a grant subaward from the state, we are responsible for auditing and compliance for immunization quality for all VFC providers that are in our 4 counties, and we've completed 4 of those audits in 23-24. And we started scheduling patients in Crescent Valley in March of 2024. The RN and the APRN go once a month, and we, in June, had 5 patients scheduled in Crescent Valley, which was huge for us, actually. We are looking forward to this fiscal year, anticipating services to expand since we did obtain our Medicaid contract, and we are working on contracting with the other insurances, as well as a memorandum of understanding with Women's Health Connection, which will allow us to treat more people and get them more expanded services. And we'll continue to do community outreach events and find ways to let people know that we're here. Any questions? Thank you.
None from me. Thank you.
Yeah, I think actually I have a couple questions. Just, and it could be something for yourself or Darren, but you know, in the first year, obviously it takes a lot to build and get this started. So I think the numbers look great. I guess I'm wondering, in the population that you're serving, are you finding that we're filling a niche or replacing a niche? You know, is there enough resources clinically for them in these counties? Or are they just looking for another resource for service? I'm like, are more people without health care and need more of health district coverage? I guess I'm kind of looking at demographic modeling.
This is Desi from the Desiree Reeves Clinic Services Manager. We're finding a mix of both. We have patients who come in who are just looking for, they don't want to drive to Reno and they want to have a PAP, for example. Okay. I find the challenge for that for us has been that we don't necessarily have their insurance contracted yet. And the cash pay, if they aren't on a sliding scale, is a little bit expensive. Not ridiculous, but definitely higher
Higher than
most
insurance,
people would want to pay out of pocket. So we kind of have a mix of that, and then the patients who end up to us because they don't have insurance or don't have a provider. So we try to fill as much of that gap as we can.
Okay, perfect.
Thank you.
Thank you.
Mr. Chairman, members of the board, for the record, Darren Winkleman, I think part of that too is people have a sense, at least kind of some of the feedback, now they get a lot of it, but Desi probably obviously gets more, but they like the anonymity of it, kind of anonymous when they come in to our clinic, and obviously we can serve some of that younger population as well without parental consent, which is.
That was kind of what I was wondering. Some,
Yeah.
there's a lot more rules around reproductive healthcare and treatment this year, and a lot more where family planning. So I'm kind of looking at, if we're seeing that probably expanding in the years to come in the counties where we're going to see more of that, so.
What's interesting, just for the record, is that we're also, we're not seeing as the influx in Lovelock in Pershing County. And so want to try to understand that a little bit better, what services there that are not allowing or are allowing. I'm not sure how you want to phrase that, but we need to kind of dig a little deeper into Pershing County to find out what's happening there. Because we see the increase in all the other counties. Eureka, not so much, a little bit. As Desi said, we're getting a few more patients out in Crescent Valley, but Churchill County, City of Fallon, and then Mineral County see an increase.
Mineral County really liked the confidentiality of the health district,
Yeah.
so.
I don't understand that Pershing comment.
In Pershing County, we're just not in the clinic services part of what we're doing, and we're not seeing a lot of patients that are at the clinic there in Pershing County, Lovelock. So we're not sure why. I believe, and these guys can correct me if I'm wrong, I think the word is out there. Maybe we can do a better job at that, but we're just not seeing that increase in patients on that side.
I don't get the part about not allowing.
Yeah, I'm not sure if people just not sure that what we allow sort of thing and how we can see patients and when we can see patients. I don't know if they have that understanding quite yet of the services we provide, and so I think there may be a
I
little
don't get the
reluctance.
allowing part.
So-
What's that mean?
Just that, I don't know how to phrase that a little bit differently, I guess. They just don't know that we have that service there, or maybe they can't go there if it's an insurance issue or non-insurance issue. Maybe they don't feel comfortable coming to us, just all sort of that bundled into one.
So it's more of availability than allowing.
Yeah, it'd be a better way to put it, absolutely, yeah.
Did Pershing have a health district nurse and office before that, before the CNHD was created?
Yes.
Okay. And so have we measured volume prior and now
I
to
know we
see
have
if
some-
there's a gap?
Yeah, I know we have some data, and I don't know if we have it with us for what they were seeing on the state level before we
Okay.
took over, but we can certainly take a look at
Do
that
you
and see
know
if we
that?
can compare.
Mr. Chairman, Desiree Reeves. I don't have the exact data, but the state nurse told us they were actually only going there once a week after COVID. Their numbers were down, but they definitely saw more than we do because they would average 2 to 3 patients when they would be there, and we have times where we go and there's no patients at all. Our APRN and our RNs and our community health workers we've done everything. We go to events and we give flyers and we tell people we're there. We just haven't seen the volume from Pershing County that we have from Mineral and Churchill County. And that's, I think, really where Darren was going, is we don't know what the gap is. Where are we missing information somewhere to get people to come into
So
Pershing?
we are marketing there.
Absolutely.
We are,
Okay.
and I see it all the time, but we somehow are not getting to all the people. The location did not change. People changed, but is that the reason? I don't think so. I think that they just,
Well, that concerns me because we're supposed to be doing public health.
yeah.
And why is it increasing except there?
That's a concern of ours as well, sir. We're trying to find a way to, that's just been the challenge. And we were hoping that we'd get busy enough that we could, be there more, but it hasn't even been busy enough that when we're
So
there.
we're-
we're
How many
doing-
people live in Pershing? Like, what's your populace, do you know?
In the prison?
Oh, no, how many people live in Pershing?
Oh, 7,000.
Okay, I'm just trying to
Well,
figure
now-
out how to
well,
survey
we
your
always-
people.
We always get tagged with 7,000. Where 1,600 or 1,700 of those are prisoners.
Okay,
Yeah.
But you would still have a
But it's still
percentage
a big
increase,
number.
not, I wouldn't say flat, you would still have an increase as you increase in other places.
yeah.
I don't know, that just
Yeah.
concerns me that we're,
Is it outreach? I don't know. I wish I could say it was.
Mr. Chairman, if I
simple as
could mention, this is Desiree Reeves again, if I could mention one thing, the one on the positive side of that, our flu vaccines last year, our flu pod there, and our back to school, biggest numbers of every county. Three times what we did in Mineral County and more than, well, double what we did in Mineral County, I'm sorry, and 3 times what we did in Churchill County in Pershing County. And our back to school vaccines were the highest numbers as well. So going to those events, not coming into the clinic, we're having small numbers, but going to those events, they're much larger.
Ted,
Thank you, Mr. Chairman. Ted McDonald for the record.
thank you, Desi.
I'm kind of looking a little bit more, kind of a big overview for what I'm seeing occurring in the counties. And it's not, public health is doing well because public health is not our clinic. Public health is our environmental sciences, epidemiology, the whole environmental, the whole package. The counties are really using our environmental and inspection services. So those things are really going well. And we're almost overwhelmed, and it's one of the biggest areas we keep growing with. There's a lot of areas that are really clinically satisfying. Lovelock and Eureka have really excellent clinical services. And the demographics, most everybody's employed. Not everybody, but most everybody's employed in those areas. And a lot of what we're seeing in our clinic situations are people that are indigent, or they, when I work with the school, we had 18 patients last month, and most of them, English was a second language, or just did not have insurance. So we have a population difference, I believe, and I think that we're not seeing as big of growth in Mineral County and Eureka and Lovelock, because they really do have a good, satisfying base of medical providers there.
Well, but Mineral County's numbers have gone up.
Uh-huh.
And Desi said people are weighing self-pay versus insurance and going to the Fallon Clinic to go into Reno. So that doesn't work for me with, even if people are employed in Eureka and Lovelock, then those Eureka's numbers are up, because only Lovelock's were down. So we have one outlier, is what I understood in that report, is Lovelock, not Eureka. So those aren't comparables to me.
So with Eureka, I'll still stand by.
And I get the environmental thing,
Yeah.
we weren't discussing that, we were only discussing clinical. I don't know, I'm struck by that fact that we're talking one place in our 4 or 5 headed thing here, if you count the city, but what are we missing in that one count, in that one place? Unless you're telling me Eureka's down, and then I get your employment thing. Or Eureka's the same, and only Mineral County and Churchill County numbers are way up. Then I understand this indigent or unemployed or something. But if you only have one outlier, something getting missed in that one place, somehow.
Yeah, Mr.
And
Chairman.
sometimes we get in the forest and don't see out further.
Yeah, Mr. Chairman, members of the board, for the record, Darren Winkleman. I think what I wanted to make sure everybody understands is we're not ignoring it. We want to understand what's happening there, and so we're trying to figure it out. We just haven't been able to put our thumb on it yet. So that's why I mentioned it. It's something that we recognize, and we want to make it, better, and we just need to figure out what's happening.
Unless there isn't a problem there, in Ted's view, there isn't a problem, and it is fine. And I really don't want to waste a lot of resources trying to fix something that it doesn't need fixing.
Yeah, it sounds like it's, opportunity if it's there, but I know why family planning is really high in Mineral County, and also why there's a lot of consensus of confidentiality. We're a really small community when you come down to it, and most people don't even want to go to their regular practitioners for some of these things because it just feeds through the community before you get out of the doctor's appointment. So I completely get that. And maybe they don't have that issue in Lovelock as much. But if they were seeing them for certain things, I guess I just want to make sure that people still have that access, and that maybe it was replaced in the time frame and they're happily served. But it's always nice to know where that leakage went. So, yeah.
I'd really like to know those numbers before we started versus now, when they had their health nurse.
Yeah.
And then now, that would answer a lot of questions, I think, if you can get those, Desi.
You have musical mics?
Yeah. A little difficulty. Mr. Chairman, members of the board, for the record, Darren Winkleman, if there's no more questions on the clinical side, we will turn it over. I think next in the packet is our public health preparedness. And I'm going to turn it over to Maria Menjivar to give a quick update on what's happening on that side.
Good afternoon, members of the board. Maria Menjivar for the record. Here to you to highlight public health preparedness, and I'll go ahead and highlight environmental health while I'm here as well. So from where we started with public health preparedness, there's been some changes of staffing. So I am the new manager for public health preparedness, and I know it started with a different manager, but today I am the manager for this program. And so where we are today with this program, we have established ourselves throughout the district and are making appearances and presences for all the LEPCs, the Local Emergency Planning Commission meetings. We are being an active member in each one of those and actively participating. We're also engaging with the emergency managers and having meetings with regards to flu pod dispensing in each of the jurisdictions, because we want to make inclusive decision-making as to how we're going to move forward with support for traffic control in each one of these flu pods, as well as staffing staffing has been available for tabletop exercises in this last fiscal year for public health preparedness. We attended the Fallon Navy Base tabletop exercise, as well as a COOP exercise in Pershing County, and work with the emergency manager there. And looking forward into the future for public health preparedness, we're hoping to utilize the partnership from NACO, the Nevada Association of Counties, and Dr. Packham in building these foundational public health surveys and community-wide assessments to utilize this information and make strategic plans, continuity of operations plans, mass casualty plans, emergency operations plans for the district. So we're hoping to be able to obtain this information in the later part of the fall and start planning for the district. Now for environmental health, bless you. For environmental health, some highlights. We have established ourselves in the district and are performing resources of inspections for the different programs that we serve for the district, and are making inroads and headways on responding to complaint investigations as they come in. And we're also trying to partner in response to whenever there are construction inspections happening or remodeling of establishments happening in the district. We are making appearances as much as we can to the major festivals that have occurred, including Armed Forces Day for the district. And like, as you heard earlier, we are going to be making a presence in Burning Man as well. For this past year, we made and accomplished inspections, remodel inspections, complaint investigations, and the numbers are before you in our graphics. For this fiscal year, our goal was to make partnerships with all of our industry and stakeholders and establish ourselves as the main contact for any environmental health related concerns in the district, and partner with our new food board, which we have been able to successfully stand up. We have a food advisory board, and we are having quarterly meetings for our board as well. And we are making sure that our website information, our social media information pushes out information for preparedness and foodborne illness as much as we can in, I want to say, that's compatible in association with the flu season or the time of the season. And I would like to honorably mention and thank Darren Winkleman for all of his help in spearheading the district for this first fiscal year. And I'd also like to mention our staff for being able to successfully build the environmental health and public health preparedness program. It takes a village to build this program. There's many different factors involved, and so I'm very grateful for everybody. And I'm happy to take any questions at this time.
On your preparedness overview, did you say something about a traffic plan?
Maria Menjivar for the record. When we're talking about flu point of dispensing, we also try to frame in traffic control and try to schedule those out, collaborate and partner with our traffic control to be able to schedule flu pod dispensing.
Okay.
Yeah.
Because, there's traffic control in regard to a lot of stuff LEPSI does.
Yes, correct. And so the local emergency planning commission does traffic control for emergencies, and I'm specifically focused on flu pod dispensing, which is maybe somebody's helping us making sure that there's no car crashes if we're using drive-through clinics, or trafficking people as they're coming in and out of the flu pod, not for emergency preparedness. Yes, correct.
We might be able to use your help.
Happy to help any way we can.
For the
Parade control,
sorry.
Say that again?
on parade control.
Okay, I'll get back to you on that.
On the environmental help, I'm struck by these numbers.
Yes.
On these, well, not just your pie chart, but those numbers, the percentages are very enlightening. I've seen that chart before, as you know, that night we were out there with those businesses, but those inspection numbers, I'm surprised by the number of temporary events, and also the business open and reopens.
Yes, sir. Maria Menjivar for the record, to you, Chairman. and members of the board. I keep pressing the wrong button.
Yeah, it happens all the time.
I just want to let you know and highlight that there is a lot of remodeling, a lot of changes, a lot of construction in the district. And I'd like for you to know that we've been heavily involved in immersing ourselves so that we partner with industry, because sometimes there's a lack of information. And so a lot of the operators or contractors or superintendents, they start doing the operation without cluing us in. And so even though we're learning about it secondhand, or maybe we found about it in the newspaper or social media, which is the greatest avenue of information that we have today, we are helping people at the tail end or at the beginning end of any type of remodels, but they are happening. And I'm hoping to share more information as we get it, because I think it's wonderful that the district is growing. Even if there are changes of ownership, that still means that there's a lot of progress in the economy. And then as far as inspections, yes, there's a lot of temporary event inspections. And we're happy to highlight those as well because we want the community to know that we're there also on the weekends. Environmental health work does not end Monday through Friday at 5 o'clock. In fact, all of our issues, I want to say, happen at 5 o'clock on Friday or on the weekend. So we are always ready for anything, yep, for environmental health.
I know we're trying to work with you better in the building department at the city at the beginning end to tell them, you know, to get a hold of you before they start, because it's a lot easier before they start their work or their remodel. Now that you're here and not, you know, 70 miles away, but,
Yes.
and those temporary events, as you know, we've had a lot of these 5 o'clock things. We know that for a fact at the city for decades now, that's when all these events happen, or, as you know, they want a liquor license at 5 o'clock on Friday. But those numbers are like, I would have thought like those food services would be double that, maybe triple that, and not so much on the other two ends. I just marvel a little bit at those numbers.
But more to come.
Thank you.
Any other questions or
Denise,
comments?
I think Denise.
For the record, Denise Ferguson, thank you very much. I think that honestly, by what everybody said and also by the report, there's more traction and a recognition of what's available, and these services are highly needed, I know, throughout all the counties. I guess my question is, this seems to be an area where it's really utilized. What's our long-term thought of, or what's the availability for like environmental research grants or anything where you would do studies? I know right now we're just working with what is being requested. And this may be not a question you're prepared for right now. Maybe I'm throwing things at you that are like more global and in strategic goal planning. Just kind of what's available out there to do for the district.
You want me to?
Yeah, for the record, Darren Winkleman. Yeah, it's interesting you bring that up because we talk about that a lot in terms of the grants that we receive with the district, and those grants are really funneled towards the clinical side of services. Environmental health, we don't, right now, don't receive any grants on the environmental side. And so I know Maria was successful in getting a USDA grant, I believe. She can talk a little bit about that, but it's a smaller one, but it's a start. And we certainly want to look further on how we can, you know, what's truly out there on the FDA, USDA sort of side of things that we've really never, I guess for lack of a better research at this point. So I think there's opportunity, we just need to follow it.
Yeah, I don't know how much there is available either, but I know looking at how popular that component is of what you guys are doing, just trying to find a platform for more revenue to feed that, just looking down the road, yeah.
Yeah, because I know it's hard for us that we, look at our counterparts throughout the country, and a lot of times when you look at environmental health, they're just underfunded in terms of the grants, and so what they do, and I maybe keep this a little quiet, but they just start to raise fees, right? So they go into the fee side of things and say, okay, we're going to raise permit fees, we're going to raise this fee, that fee, and I don't know if is that sustainable? I don't know, and it's certainly, I think, in my perspective, in the rural areas, that becomes very, very difficult for some people. And so I think it's our obligation to go look for those other opportunities and the grants that are out there to help support that side. Because that all of the divisions we have are super busy, but it's a lot of times not focused on environmental health. And so we need to change that a little bit.
Yeah, I know you guys are working with LEPC and the various coalitions for counties. Have you ever had a meeting with the Nevada Lab Grant Group?
I haven't had a meeting with them at this point. No.
I would recommend it. They're fantastic and it's free. It's funded by the government through a grant through the state of Nevada, and they will target you to areas of grants that are specific to your health district needs. And they'll actually help get grant writers for you, and they'll pay it through the grant. So they've helped me through hospital funding, so I would recommend it with health district stuff.
Great, thank you. Yeah, look into that.
Any more questions? Public? No? Thank you, Maria.
Thank you for your time.
Darren?
Mr. Chairman, members of the board, for the record, Darren Winkleman. Next up is our epidemiology, and Victoria Sepsic, if you can come on up.
There you go.
Just push it once.
Okay, I'm sorry. Hello, members of the board, Mr. Chair. I am Victoria Sepsic. I am the Epidemiology Program Manager for the Central Nevada Health District. I oversee the Communicable Disease Surveillance Program. I have provided an update for the last year on what we've accomplished, what some of our goals are. So I was brought over from the state of Nevada. I managed their communicable disease program for the last couple of years. I started with the health district in November. At that same time, we were able to bring on our disease investigator. She is investigating STDs, all of our general communicable diseases. We also investigate our healthcare associated infections, tuberculosis, basically everything that is a reportable condition in the state of Nevada, we investigate at this point. I'll give you a brief, a little overview. If you take a look at our numbers, our STD rates, I've looked at them over the last couple of years. We're not really seeing an increase or a decrease. Obviously, we have a couple of STDs that are a little bit higher than others, as you can see, and that is pretty normal for the rural areas of Nevada. Our general communicable disease rates have been pretty steady. We do a daily surveillance and monitoring on all of these diseases. We have made sure that we are in compliance with all of CDC trainings. I have made sure that my disease investigator is up to speed on all recommendations from the CDC. We are working closely with the school nurses to ensure this coming up school year that we are on top of any school-wide outbreaks. Respiratory season is coming up, any GI outbreaks. So we have a working group with our county nurses, which is really great. This year we were able to accomplish a respiratory virus dashboard, which was updated weekly, which was kind of great because it gave the communities kind of a knowledge of what is going on, what's circulating currently. You know, is RSV going around? Is COVID going around? And then we can let them know if there's currently a surge going on. And then we applied recommendations, you know, social distancing if we can recommend it. If you're not feeling well, please stay at home, masking, those types of recommendations. We have created a lot of community engagement. We have created a lot of social media pages, brochures. We are working on a lot of policy development. We have created a 24-hour emergency response phone line and an email that reaches out to us night or day if there is a disease to report. We have created a health alert distribution network, which I think you guys might all be on, where I let you know of anything that I find or we find to be of importance that we would like to relay out to the community. We are working on local hospital partnership and relationship building. We are working on our STD rates. We see that they are high. They're our highest morbidity, which is common, but we are working on community engagement. We have a commitment to understanding and addressing the social determinants of health and how they relate to these increase in, or the rates of STDs. We do work on a lot of education and awareness. We are constantly putting stuff out on social media. We're increasing our testing availability and access to treatment for these STDs. We have condom distribution, so we're working on promoting safe sex practices. Some of the protocols that we are working on right now, we're working on animal bites, like we talked about, for rabies, handling animals, getting them tested, getting them shipped to the animal disease lab. We're working on foodborne illness protocols on what to do if somebody in the community reports a foodborne illness and they would like to have, or some sort of illness and symptoms, and they want to be tested. So we're working on stool collections and how to get that fast-tracked to the state lab to be tested. We're working on our vector-borne diseases. We're working closely with the mosquito abatement program for any vector-borne diseases. What's really great, and I would like to highlight, is since coming here, because when I was working with the state, I did a lot of the work that I'm doing right now, but I did it as a state as a whole. I really want to highlight that we have a very low loss to follow-up on our cases, which is really great. So when we reach out to our cases, we're getting answers. When I was with the state, because we were covering most of the communities, the frontier communities, so we had about 13, we might be able to only do one phone call, maybe 2 phone calls, and that's it, and then we would have to close the case and move on. But here, it's great because it's me and one disease investigator, and it allows multiple follow-ups. So we've actually created a priority grid. So if somebody does not answer, we do field visits. So we have started doing field visits because it's sometimes hard to locate people. So if they're not treated, if they're pregnant, if they're high risk, we are going out there to bring them in for treatment. So it's been really great because we have, I don't know if it's just us being here within the community or just having a more condensed caseload, but we are reaching most of our cases, which is really great. Because it's unfortunate when you have, say, a positive STD that comes in and you're not able to reach them, because then it's, we can't provide any partner services, we can't provide treatment to them. So we want to be able to make contact to all of our cases. So we are doing a really great job on reaching our cases in our community. I also monitor syndromic surveillance, and that is used to investigate and respond to any potential health threats that might be out there. So I monitor daily emergency room visits, urgent care visits, ambulatory centers. So basically, it's prior to diagnosis. We can take a look and see what their syndromes, that their chief complaints are when they come into the hospital. So we can flag, oh, there's a lot of children coming in with vomiting, nausea, diarrhea. Is there a potential outbreak going on within our community? So some of the stuff that I monitor, suicide, drug overdose, heat-related illness, GI, and respiratory are some of the syndromes. And I can kind of change up our query. So if there's something in particular, if a school nurse says, hey, we're having a lot of children that are coming in with rash, I can modify our query just to find out, is there something that might be going on that's causing a rash within this community? So that has been really great to work with. I also would like to recognize Darren as our administrator. He has been really great. He has a really great support system. And I truly say that as coming from the state of Nevada, where there is not always a great support system, he is really, he puts everyone else's needs first. And I really would like to recognize his efforts that he has done. It's been really great. Our team works really hard, and it's been a really good year. Okay, do you have any questions? And thank you.
Victoria, on the case investigations,
Yes.
on these 2 lead poisoning, is that common?
On what, I'm sorry?
The 2 lead poisonings?
Lead poisonings?
Yeah, is that common?
No, lead poisonings is not very. So we investigate if they're children, so pediatric cases are investigated. We actually had 2 that were. That is very not usual. Lead cases are very low. We do get reports in sometimes for adults. CDC does not recommend investigating adult lead poisoning cases. So yes, we have had 2, and that's pretty normal. We get about 1 to 2 a year that come in for us.
Are they pediatric always?
Well, what you see on here, these are pediatrics. So
But
this is what
the
we would
1
have
or 2 a
investigated.
year that you get, are they adult or are they pediatric?
Just kids.
On these 12 hepatitis, is that normal or is that?
It's very normal. It's hepatitis C. It's pretty common. We get lots of cases in. Then we interpret whether or not they've had treatment. Are they a past confirmed case? Have they been in and out of the prisons, out of the jails? Where did they come from? But yeah, unfortunately, that's a little bit higher of cases that we see in our communities.
Is that, do you think that's from drugs, needles or?
Sometimes.
But you're not, that's what you're trying to investigate on these 12 cases?
Yeah.
Are those usually C or?
So, yeah, Hep C is our most common. So chronic means that
But are Hep C from drug use or is that a B or A or?
Well, it depends. So with chronic, it means that it's not acute, so it's not new. So that means sometime in their life, they've already been diagnosed. So we haven't had any acute cases, which is great, so that means that it's not new. So with the chronic, it could be that they've never been diagnosed before, or I'm sorry, they've never been investigated before, but at some time in their life, they have had an acute infection to hepatitis C.
And to have an investigation like on any of these, how does that come to your attention?
We get their labs. So every time anyone tests in the state of Nevada, as long as it's a reportable condition, it comes into our system every day. So then we get to review their labs and their medical records, and then we can go back to the provider and get all of their past labs and their past, so we can
So
compare.
is that reported you from Banner and Renown and every lab, Fernley lab?
Yeah,
Fernley's Renown, but.
yeah.
Are these strep group A's pediatric?
No, they could be either. They could be adult or we would investigate any strep A that comes in.
I mean, that's probably being treated though, right? That you'll find that is already,
Yeah,
especially if it's pediatric.
yes.
Interesting, thank you.
Of course. Okay, thank you so much for your time.
Any other questions?
Thank you.
Thank you, Victoria.
Mr. Chairman, members of the board, for the record, Darren Winkleman. Again, yeah, thank you to staff for presenting that. Last but certainly not least, I will turn it over to the doc here, Dr. McDonald, to give any updates or if you have any questions for him.
Dr. McDonald.
Ted McDonald for the record. Thank you for having us this afternoon and giving us the opportunity to reintroduce our staff and have them provide you this information. As you can tell, in the past, I've had them do my homework and I've presented it to you, not as my own. I try to give credit where credit's due, and they are a wonderful group of people to work with. So it's been very easy in a lot of ways being in this job. My job has grown a little bit, and a lot of it is working with the organizations that we work with in all the counties, is trying to be the face that they recognize, and the community has a face to recognize that is working with the health district. I've presented to you a lot of stuff that's already been discussed. The lead is, just to help a little bit with the lead, pediatricians and providers are supposed to do lead tests at the age of 12 months and 24 months. It's a pediatric recommendation. Unfortunately, or fortunately, the pediatricians and providers request the test to be done, but parents and guardians normally don't. So we wind up having only about 3% of the population in the United States that's checked for lead. And I just recently had one at our last clinic that I ordered a lead test for, and sure enough, the mom said, no, don't really need it. As most of you know, living in rural communities, we have lots of opportunities to run into lead. Any house built before 1970, the paint probably has lead in it. Just stuff blowing through the air. I've seen a lot of recent studies done with air quality in the state of Nevada. Unfortunately, in this area, we don't have a lot of lead particulate, but around construction sites, with construction workers or demolition groups, they can be exposed to lead, and it's easy to bring home on your clothes. So the children are more susceptible to this. It creates a neurological problem, so it attacks the nerve system. So you can wind up having permanent nerve damage or The most common one is it looks like there's a developmental delay. So children coming into school that are going into first grade that are delayed in their ability to learn and to read and to interact. One of the first things a pediatrician will do is check them for lead poisoning, because
I mean,
that's,
it's rare though, Ted. It's not.
it's not super high, but
That's why
it's,
these
it's
two
enough.
popped up to me. It's not, you don't see it a lot.
You don't
I
see it a
mean,
lot because we don't test for it a lot. 3% of the population gets tested. The CDC is now coming out. This is their big national, one of their big national pushes between this and Alzheimer's disease, is they're pushing for education to providers and parents to test for lead more often. We just don't look for it. We have the tools. But with the changes in industry and the way we do things, there's less lead available. And there's a lot more screening, looking for lead paints on toys and other things that brought the lead into the environment. We don't see that as much. But rural areas are at more risk, especially older rural areas, because of the older buildings, and mining is another one where we've had, and what's in the dump sites. Fortunately, we don't get that very much into the air, but there's a potential for it getting into the water supplies, and that's why I'm so happy that we test for water very well here. Is there any
Yeah,
questions?
we've
on-
tested for lead here a lot, and it, because,
Well,
go back to Bob's days, you know, it's
I
it's
worked
been a
with-
scare that
I worked with Ben Bartlett.
people come to us all the time about lead, and it's just,
Well, I worked
just
with Ben
not as
Bart-
present as people are made afraid of, you know, here. It's just not,
Mr. Chair?
tested for lead a lot here in the city
I
of
had the opportunity
Fallon.
to work for the city of Fallon when I was younger, much younger. And I worked with the civil engineer there, and so I was here during the time of asbestos and arsenic and everything else. Ben Bartlett was a wonderful mentor, and I learned more about environmental science than I ever want to know. And I appreciate there's a lot of things out there that, you know, we get over anxious about them.
Right. That's why these surprise me. But I don't know where they are, because you have a 4-county and city to look at, but.
We have made advances with the hospital here, as far as working relationship with following some of the cases. I found out yesterday that the hospital now has a policy where if a woman comes in and delivers a baby in the hospital and has not had screening tests for sexually transmitted infections, that the baby will not be allowed to go home until after all the test panels come back.
Yeah, I think those numbers were surprising to me too, but, you know, as I look through your numbers, Victoria, and I know you're not at a mic now, but as much information that is out there, people just ignore it. And so those numbers, I just assume they're high because they just ignore the numbers and continue on their path, you know, and that's why those STDs are what they are, you know, and so I'm glad the hospital has that policy, you know.
The other thing that they told me today is it used to take them almost 2 weeks to get their tests for syphilis. They will be starting an in-house testing, and they'll have results in 24 to 48 hours, so those babies won't have to stay in the hospital for 10 days waiting for lab work to get back.
Yeah, it's good.
Yeah. So Banner's been very cooperative in working with us. It's been a pleasure. And any other questions?
Any questions for Dr. McDonald? Any public questions?
Thank you.
Being none, we'll go to item 10, public comments. Must be general in nature, not relative to any item on the agenda today. Discussion can be held, no decision can be made. Is there any public comments? Being no public comments, we'll go to item 11, which is adjournment. We stand adjourned. Thank you all for coming. Sorry for the delay in getting started today. All